Other good news is, interestingly, right now, when a doctor is not on an insurance plan, 9 times out of 10, it's because the insurer dropped them, not because the doctor dropped the plan. And ColoradoCare is open to any licensed provider who would like to practice in our state.
ColoradoCare allows the members to select their primary care physician. So at that level, if, as Dr. Aguilar said, your doctor chooses to remain, when price controls are put in place by the 21-member board, dictating what the cap of what that doctor might charge will be, then yes, you would be able to choose your primary care physician. When it comes to specialty care, that's unknown. We don't know if we will be able to choose the doctors that we are accustomed to using for specialty care in Colorado. That will be up to the 21-member board. And people with chronic health conditions should be concerned about that, because we don't know if we can see those doctors, if our specialty medications will be covered, if durable medical equipment will be covered. All of that is unknown.
I want to ask this question from Twitter from Nathan, whose profile says, Caped Crusader fighting the evil private health insurance empire, for some context. And I haven't done a fact check on this myself, so I apologize. But the question being, is it true that, here's how the question reads, is it true that 99.9% of opposition funding, about $4 million plus, comes from private insurers and other for-profit special interests?
Okay, Nathan. First, let me tell you that our funding is a matter of public record. You can go to the Secretary of State's website and see dollar for dollar every bit of funding that we've received. Have the health insurers provided funding to our campaign? You bet they have. They don't want to leave the state of Colorado, and yes, they've provided funding, as have hospitals and other medical professionals, businesses throughout Colorado. We have almost every chamber of commerce opposed to Amendment 69. They're supporting this effort. The healthcare industry is not, however, running this campaign. They did not start the campaign. They're not leading the campaign. And if you look at our contributor list, you will see that over 50% of our contributions are from individuals who contributed $100 or less.
Dr. Aguilar?
Thank you. And I have not looked recently, but I do know that Anthem Blue Cross Blue Shield contributed $1 million to the campaign, that the Kaiser Health Plans contributed $500,000 to the campaign. United Healthcare contributed $450,000 to the campaign. And amazingly enough, some hospitals whose mission is to ensure health care to everyone in the population have contributed $250,000, including Health One and Sisters of Charity of Leavenworth.
I want to go back down the road of ColoradoCare's in place. If I am ill and I'm out of Colorado, what do I do?
Thank you. The amendment specifically states that the Board of Directors must pay for care for people while they are traveling and out of state.
How does it, so I have to kind of delve a little deeper. How does that work? When if I'm at the doctor and they're making me fill things out and they expect some sort of something, some card, something that says they're going to get paid in some way.
Right.
Since this hasn't been done yet,
right?
How is that intended to work?
So the example I use is Kaiser. I have Kaiser, and as you know, not every state has Kaiser insurance, but you present your insurance card, and providers actually by law, if it's an emergency, cannot make you pay before they give you treatment. They are required to give you treatment. Providers otherwise have it at their own discretion, but just as they may not be certain about whether Kaiser would pay them, perhaps they'll have some fear about ColoradoCare, but hopefully the reputation we established is of quick, prompt payment.
Is this a fear?
I think it's a concern. The amendment does provide that if we fall ill or are injured in another state, that ColoradoCare will step up and cover that illness or injury, but only to the level of the price control that has been set for Colorado providers. And if that price, if that dictated government provider fee is not what the doctors in Utah or Wyoming or wherever we might be are charging, it's an out-of-pocket expense.
I'm going to take a quick reset here. You guys can catch your breath, as I just want to remind people that this is a debate on ColoradoCare, Amendment 69. I'm Marshall Zellinger from Denver 7, alongside State Senator Dr. Irene Aguilar, one of the crafters of Amendment 69, and Michael Cook, campaign manager for Coloradans for Coloradans. We're debating the single-payer health care amendment that will appear on your ballot in November, which really means in the mail-in ballot that you get the week of October 17th. Can't always forget that. And you can submit your questions right now on Twitter, #TapTheVote. You can also watch this, which if you're hearing me right now, you're watching already from the Denver Post Politics Facebook page or the article that they have online, or you're watching on the YouTube stream. But so far, Tap the Vote hashtag might be the best way to get a hold of us. And those of you in the audience have written some questions that I'll stall just a little bit so I can get them in my hand. I believe that whoever controls that probably heard you, and we'll work on that as I'm stalling right now. And I want to remember that we're starting back with Michael Cook on the no on Amendment 69 side. So I'm trying to find a question that might fit that best.
Okay.
I'm not sure that any of these do that. Well, let me ask, as I'm searching through this, you've made a couple comments that there's a concern that it's in the state constitution. If this was done through the legislature, would that have eased your concerns at all?
Certainly trying to find reforms through the Colorado legislature would ease my concern. There is still a concern about Colorado going it alone on a program like this. That concern doesn't go away. But taking steps to reform our healthcare system through the statutory process, that's what we should be doing, instead of scrapping everything for an untested program and putting it in the Constitution. And if I can give you a very quick example of a flaw that will go into our Constitution, there is an existing exemption for Social Security recipients and pension recipients in Colorado today. The first $20,000 to $24,000 of income for Social Security and pension is exempt from Colorado state tax. This amendment suggests that it will support that existing Colorado statute. It cited the statute incorrectly in the way the language is written. So right now, we have a problem. If this is approved by the voters, there is no statute that matches the one that is written in this constitutional amendment. That should put seniors at great concern.
To be fair, we're going to start over now because it sounds a lot better. No. Dr. Aguilar.
Thank you. And I don't have it at my fingertip, but what I could tell you is that it is a statute where, for example, it's 25.5, 102, and there is an A and a B, but what it says is 102. And so that's what's being cited as an error. So it does actually encompass the entire section 102 or whatever it is on the tax form. In addition, I think it's important that people know that the reason this is an amendment is because in order to collect $25 billion in revenue and not have it count against our state's TABOR limit, the ColoradoCare had to specifically exempt itself from TABOR. And so that is why ColoradoCare is an amendment. And for that reason, the guidelines are guidelines and not specific statements. The entire ColoradoCare proposal is 12 pages, only 9 pages of substance because it's guidelines. And finally, having worked in the legislature for the last 6 years, I can tell you that I tried to get the legislature just to get a group together to see if we could do something like this at a state level, and you just could not get the consensus there. Unfortunately, since the passage of the Affordable Care Act, healthcare has been made into a partisan issue, and yet illness is not partisan. The need to access medical care is not partisan. And putting something in the Constitution, as I've seen with Amendment 64, does lead to the legislature in good faith working to enact the goals of that amendment.
This question comes from Laura, and I know we've kind of gone down this road. This goes a little deeper. the wording of the question is, how would this implementation look going from a state with PPO care, HMO care, to a system with a single government-run care? So that transition period, I know we've talked a little bit about, but is there ever a lag time where care is uncertain?
Thank you. So the Board of Directors needs to give 90 days notice before ColoradoCare is ready to be implemented. And it's during that time that the transition will happen, much as it happens right now in the first of the year, where you get a new insurance plan that starts the first of the year. So you have a date certain, and that date is planned for. There are some HMO models in our state. The one I'm thinking of specifically is Kaiser. It actually is a very value-based payment model, and I would imagine that Kaiser providers could continue to work under that model, but instead of getting their monthly premium from an employer, they would get it from ColoradoCare.
During that transition period, while we are working on the analysis, the feasibility study, and trying to determine how to apply for that waiver from the Affordable Care Act and the Medicaid waivers that will need to be granted as well, our insurance industry, should this pass, could be in a state of flux. And as I said, there's no date, there's no pull the plug date when we must implement ColoradoCare. Insurers could begin to leave the state. We don't know what will happen to the coverage we have during that transitional period. Things could very well be in a state of flux.
This question comes from Joel, and he wants to know, why do you say this will impact the most vulnerable the most?
One of the reasons that I say that it'll impact our most vulnerable citizens in the state of Colorado is that we have a number of citizens who are on Medicaid today, and they don't pay for that coverage, but they're working, trying to provide for their families. They don't make quite enough to get them off of that Medicaid roll, but they're working, and now they're going to pay tax. So that's my reason for stating that it will affect our most vulnerable, the people we're trying to help.
And I know, Dr. Aguilar, you probably say the opposite, that you'd start benefiting the most vulnerable.
I think there are a couple of different outcomes here. There are some states that have instituted payment for Medicaid from Medicaid clients based on their income, and so that's not unprecedented. But the terms of the waiver would be what determine that. And in our state, we do have an earned income tax credit, and so some of that potentially will come back to them through the earned income tax credit. How that exactly would work out is difficult to see. What's most interesting, though, is that right now people on Medicaid who work frequently have the situation arise where they're on Medicaid 1 month, and the next month they get a bonus, and they're dropped from Medicaid, and then suddenly they have these outrageous bills. They would have consistent coverage with the same providers throughout their lifespan with ColoradoCare.
This question comes from Susan via Facebook, and I'm trusting the stats here, so I apologize again for not having fact-checked this myself. In April 2011, Vermont adopted a single-payer with a proposed 11% payroll tax. It was abandoned in 2014 because they couldn't afford $2 billion to fund it, so says the question. So how can Amendment 69 save money?
So Vermont actually is a very blue state, and their legislature passed a single-payer bill, and their governor signed it. And then they said, great, we're going to do single-payer. Let's take a look at how much it costs us to provide health care, and how are we going to pay for this? And when they sat down to look at how to do that, the first thing they found out was that, in fact, 40% of their population left their state for medical care. So they really didn't have the opportunity to do great bulk negotiation for prices. The second thing that happened was they had everybody at the table determining who will pitch in and how much will they pitch in, and suddenly groups were carved out as not having to pay. So that at the end of the day, and they only had a population of 600,000, the people who were left still at the table were up to a 19% premium. Now, because I'm in the legislature, because I grew up in politics in Colorado, I actually started with, what is healthcare going to cost us in 2019? I got that number from the Colorado Health Expenditures data, which is available publicly for folks. I went to our own legislative council and I said, what money do we actually get in from Medicaid and from the Affordable Care Act? They gave me that. I said, okay, now I need to collect $25 billion. At what level, based on our collections, do we need to set the premium? And so we started with the finances to be sure that the money was there. And even the Colorado Health Institute report agrees that assuming we were granted the entire Medicaid funding, we would have a $2.5 billion surplus year one.
So Vermont, I think, is a good example and something that we need to look at. Governor Pete Shumlin is a champion for single-payer health care. He campaigned on single-payer health care. He got it through his legislature in 2011, and they spent 3 years and taxpayer dollars doing the feasibility study, doing the analysis, just as ColoradoCare will need to do, and determined in 2014 that they could not sustain it, and he pulled the plug on his own program. And in doing so, he said that the economic shock to Vermont would be too great. And we have a risk of economic shock in Colorado when we are going to have the highest income tax rate in the nation under ColoradoCare. We're at 4.63% today. We're going to 14.63%. Are we going to attract quality businesses to Colorado, or are they going to flee? Those businesses that came from California, which has a tax that caps out at 13.3. And when Dr. Aguilar talks about people fleeing Vermont for better medical care, wait till we have free health care in Colorado, and let's look at what medical tourism looks like.
I have so many questions that I have to go off the cuff real fast since you referenced the 14.63. This is the last reference I'll make to my fact check that I did a little bit ago. Our analysis was true, but not all would pay the highest, and here's why we said that. For those that would be paying 14.63, which I didn't have it summed up here, but correct me if I'm wrong, I believe it would mean business owners who would be paying the entire 10%, or if you run your own business, you're not an employee, so you're covering all 10%. So people like that would be paying all 14.63%. But if you are an employee of someone, you'd be paying the 3.33% in addition to the current 4.63%. That would get you to 7.96, which puts you 10th in the US. So not everyone would pay the highest.
So you did the math and you came up with those great numbers, but what I will stand by is that our effective income tax rate will be 14.63. When you look at income tax rate calculators across the nation, those calculators that rank states, they will use the 14.63. At 4.63 today, not everyone pays 4.63. There are exceptions to that as well. The effective tax rate for Colorado, income tax rate, under this proposal would be 14.63.
Dr. Aguilar?
Thank
I might have
you.
said your side, I don't know.
First of all, I do want to say that you need to remember that this is not all going to state tax. This is going to replace the amount that you spend right now for healthcare premiums, deductibles, and out-of-pocket expenses. And the data we've looked at a national level indicates that a business who does provide health care to its employees spends 13.5% on the exact same health benefits that they will get with ColoradoCare at 6.67%. And so it will be a significant savings to those businesses that do provide health care. Now, those businesses that we've read about in the newspaper who have intentionally cut employers' hours from 30 to 28 to try and avoid paying for their health care benefit will be made to contribute to their health care benefit in ColoradoCare so that there is no incentive to unfairly cut workers' hours.
Tara on Twitter wants to know why there's no opt-out for the military or Medicare, and wants to know if the public would be educated on how to use this if it passes.
So Medicare is, in general, there have not been many waivers granted from the federal government, and so A, B, and D would continue. People on Medicare, for the most part, are either disabled or retired, and under Colorado state taxes, you actually get to exempt a large amount of your income as retirement and pension income, and so those folks will only pay on the amounts above the state-allowed retirement. And this will become their supplemental plan. A supplemental plan in the metro area for a couple cost about $4,600 a year, and so ColoradoCare becomes their supplemental plan.
Ms. Cook?
And I would say that this is very unfair to our senior population in the military, who are covered by federal programs and will continue to receive their coverage for primary care services from those federal programs, for which they have paid into for years and continue to pay. The interesting thing about the language in this amendment, we often hear the proponents talk about how the senior exemption at the federal level, you know, you're not going to pay the full amount of pension or Social Security because of federal provisions in the tax code that give exemptions to the amount of tax you would pay on Social Security. The language in this amendment, whether intended or not, says total income. And it specifies the lines on the federal 1040 return that are subject to tax on the total income. It doesn't say taxable income. It doesn't say adjusted gross income. It's total income. So for seniors who get an exemption on federal tax for Social Security, that exemption will not apply for the 10% tax that will have to be paid. And I renew what I said earlier. There is question and doubt about the state $24,000 exemption now because of an error in the language of this amendment.
I've been getting lax on the time a little bit, but Dr. Aguilar, are there points there that you'd like to rebut, even though that was her rebuttal?
You know, I have to say that I am not an accountant. I have had a PhD accountant look at this, and we have a disagreement between accountants, which I'm beginning to think mirrors the disagreement you'll get between two lawyers. But I am certain that the intention and certainly the line referred to in there was to exempt from taxation for seniors the amount that is exempted from their state taxes.
We could go down this rabbit hole, and I shouldn't. Maybe we can get back to it. I want to ask Jim's question for Ms. Cook. If he were to vote against Amendment 69, what hope should he have that prices will stop going up every year as they do now?
And to Jim, I would say, you know, the cost of healthcare continues to rise. And the CHI report, as I said earlier, points out that the cost of healthcare will rise at a rate greater than the incomes of Coloradans that will be providing the revenue for ColoradoCare. We have much work to do, but Colorado has made meaningful progress. We've made meaningful progress in getting our uninsured rate down from 15.8 in 2011 to 6.7 in 2015. We are trying to take those steps. The Commissioner of Insurance has put together a task force. I hope to see some good come from the work of the people who are giving their time to that task force to look at how we can control costs. But the costs of healthcare are rising. Why are imaging costs so high? Why are prescription meds so high? We've got to get to the root of the problem.
In rebuttal, does this lower my costs at all, or does it keep my costs static?
So your costs are guaranteed to stay at the 3.33 or 6.67 unless there is a vote of the membership of ColoradoCare to increase the rates. And as I stated before, using CHI's number, if we are granted the full federal waiver, and again, without that, we could not move forward. So granted the full federal waiver, we would not need to be asking about a cost increase for 8 years. And during that time, 100% of the population is covered with no deductibles. And I want to emphasize that because there are two things that are hidden in the statistics that were just quoted. One is that it is true that our uninsured rates have decreased, that it can almost entirely be accounted for by Medicaid expansion. So what we've done is given, we're up to 1.3 million of our 5.3 million people in our state are on Medicaid, and there are many doctors who will not see them because of their payment rate. And every year at the legislature, we're defending further cuts to Medicaid from our Republican opponents, unfortunately. And I don't think they understand how crucial Medicaid expansion is to the survival of our hospitals in our rural communities. The second thing is that while the uninsured has decreased, those who are called underinsured has increased. And underinsured means you've bought health insurance, you still have to spend more than 10% of your disposable income to access health care. And there was a recent study released that showed that 75% of Americans don't have an extra $400 around. So that means they have this insurance product that they can never afford to use.
I apologize for all the questions that I have that I'm not going to be able to get to. I'm going to ask one more because I think it's an overwhelming question that a lot of people are thinking of, and then I'll give you guys your 2 minutes or minute to close. This question, we'll start with Dr. Aguilar real quickly here. The question is from Dick: how will ColoradoCare relate to Obamacare? Will it substitute and replace it, or does it coexist alongside of it? I know you only have 90 seconds, though.
That's right. Actually, ColoradoCare is allowed under the Affordable Care Act. There's a provision that comes into action in 2017, which is why we're the first state, that allows waivers for state innovation. Under the Affordable Care Act, they recognize that what they did at a federal level might not work at a state level, and they said to a state, if you can design a program that covers at least as many people with at least as rich of a benefit, that doesn't cost people more, and that does not increase the federal deficit more, we will give you a waiver from Obamacare to create your own state health plan, in this case, ColoradoCare. So any other states who are not happy with Obamacare, I would encourage their legislatures to look at what they might do in their state to create something that works specifically for their state. So basically, ColoradoCare is possible because of the Affordable Care Act.
Are there do you have the same concern? Do you believe that that's going to be the case?
Well, it replaces the Affordable Care Act. Just the plain and simple answer to the question.
Well, then I will ask you one last question.
Okay.
Also, before we go to the closing, and I had it and I lost it. So, forgive me as I search for it.
That's okay.
Because I put them all away. All right, so Joel wants to know, and this may be unfair if you don't know, but it's an interesting question. When we go back to Vermont's situation, do you know how many insurers left Vermont when that system took place?
I do not.
Okay.
I do not know. Well, let me back up. I do not know if any insurers left while it was under consideration, but it's important to point out it was never implemented.
Okay.
To his question.
Well, instead of force feeding another question, how about we go to closings here? So.
Okay. Can I address the Vermont question?
Oh, sure. Yeah, that's
I only want to address
You're
it
right.
because I'm still a sitting senator, so I meet with lobbyists. And I met with a lobbyist from United when our amendment had been certified for the ballot. And I said, I just want to let you know I am working on ColoradoCare. And she said, oh, that's okay. This was United Healthcare. She said, when Vermont passed their law, we actually told them we'd like to apply to be the administrator for their program. So.
Okay, so Dr. Aguilar, since you won the coin flip, you get, I was wrong. You get a minute to close. So you have 1 minute.
All right. I appreciate you giving me the opportunity to share the facts about Amendment 69 or ColoradoCare with you. We Coloradans value fairness, and we know that our current healthcare payment system is rigged to benefit rich corporations, many of whom are out of state. We Coloradans are responsible. We're willing to pay our fair share, but we want to be sure we get value for our dollar. No hidden costs and deductibles, co-payments, and no narrow networks that prevent us from seeing the doctors we want to see. We Coloradans are smart and recognize that ColoradoCare is a Colorado-run nonprofit system accountable to us, the people. All healthcare delivery providers will continue to be private, but they will trade the administrative hassles of our dysfunctional payment system for a simplified mechanism that allows them to focus on helping Coloradans stay healthy enough to enjoy our beautiful state.
I'm going to have to ask you to wrap.
$25 billion is less than $30 billion. Do the math. Like 80% of Coloradans, you will see that you and your family will get better access to high-quality health care at a lower cost. Thank you.
Thanks for making me not have to drop the hammer. Michael Cook.
So I'd like to thank everyone for being here tonight, coming out on this great fall night to listen to this discussion. I'm going to go back to my opening 3 points, that this is risky because it is experimental. It takes away everything that we know today, whether perfect or not, and puts in place an untested system, and it places that in the Constitution. It's uncertain with this 21-member board that will make decisions for us regarding our health care. And I said earlier, they're exempt from recall, but they have provided that the 21-member board, after they are elected by the members of ColoradoCare, by a majority vote, can vote each other off and replace their members with people of their choosing. That's not a democracy. That's not the way we do things in a government system. That concerns me. And I maintain that it is unaffordable. For some people, when they do the math, will it be better? Perhaps, but not across Colorado. And it hits certain parts of our population in an unfair way.
Thank you to Michael Cook, thank you to Dr. Irene Aguilar, and thank you all in the auditorium here, and for those of you watching at home or on your phone, thanks for joining us. And thanks to Denver 7, Denver Post, Denver Press Club, the Roosevelt Institute, and the Colorado chapter of the Public Relations Society of America. We hope you'll join us down the block, and you can, if you're at home, join us from home. 1330 Glenarm at the Denver Press Club, 1330 Glenarm Place, so we can continue this conversation over cocktails with beer from Barrel's Brewery. So thanks.